Hi, it's Dr. Gabal, and I'm here today to talk to you about male urinary incontinence. So, urinary incontinence is defined as the involuntary loss of urine. Anytime you have loss, whether it's a small amount or a large amount, any loss of urine that was not intended is defined as incontinence. And there are several types of incontinence. The most common type for a man would most likely be overactive bladder or urge incontinence. So when you have the feeling like you have to urinate, but then you don't make it to the bathroom in time, and that would be overactive bladder. In men, especially as they age, that is more common because of an obstruction from a prostate. And so as you get older, your prostate gland gets bigger, the donut hole around the urethra gets smaller. It makes it more difficult to get started, more difficult to empty completely. And then the bladder, being a very smart organ, realizes it has to work harder and more often in order to empty better. And so you will develop an overactive bladder in response to the obstruction. And so in many cases, if a man comes in for the treatment of overactive bladder or leakage of urine, we have to do an evaluation to make sure that he's emptying his bladder completely, that he doesn't have a bladder stone or a urinary tract infection as a possible cause of the overactive bladder and leakage of urine. And if there is a significant obstruction and the man is not emptying his bladder completely, that needs to be addressed first. And about 80 to 85% of the time, once we resolve the blockage and we open up the blockage, the overactive bladder part can go away, or at least improve to the point where the man is happy with his symptoms. And so it's a little more complicated than just giving a medication for overactive bladder. And in fact, if we were to do that for a man who already has an obstruction and has difficulties emptying his bladder, it may make it so that he can't urinate at all, and then it turns into an emergency. So that's why it's important to see a urologist who specializes in voiding dysfunction so that we can help you for any of your urologic needs.